Stroke has become an increasing problem with our modern lifestyle. So what are the early signs? How do we minimize the risk of stroke? Are the consequences of stroke reversible? Make sure you watch the video to the end so you don't miss all this information and more. In the case of a stroke, a person fights against time because the earlier the intervention, the less damage to the brain. Today, we are going to look at the early signs of stroke and what to do in case of a stroke. Before we start, don't forget to subscribe to our channel and like the video. You can also activate the notification bell to be notified of new content. If you are ready, let's get started. Stroke refers to a medical condition where the blood flow to the brain is somehow interrupted. Early signs of a stroke. 1. Vision problems. Vision problems can be related to a stroke and may indicate issues within the brain. Sudden vision loss, double vision, or blurry vision could be signs of damage in the brain's visual centers. During a stroke, reduced blood flow to the visual centers at the back of the brain can lead to sudden vision loss. Additionally, damage to the areas controlling eye movements may cause double vision, and blurry vision can be associated with damaged brain tissue. 2. Speech and comprehension difficulties. These difficulties are often the result of damage or potential damage to the brain's language and communication areas. The Broca's area, located in the left frontal lobe, is involved in speech production, and when damaged, it can impair the ability to produce words properly. The Wernicke's area, located in the left temporal lobe, plays a role in language comprehension. Damage here can make it difficult to understand words and form coherent sentences. Such brain damage can lead to various speech and comprehension disorders like aphasia, dysarthria, and apraxia. 3. Severe and sudden headache. A severe and sudden headache, especially when accompanied by other symptoms, could be a sign of a stroke, often considered a warning sign. In some stroke types, such as subarachnoid hemorrhage, a sudden and intense headache may result from the rupture of a brain blood vessel. This occurs due to bleeding between the brain tissue and blood vessels, often described as the worst headache of my life. If the headache is accompanied by loss of consciousness, vision problems, nausea, vomiting, and neurological symptoms, sudden weakness in an arm or leg, difficulty speaking, immediate medical intervention is necessary. Common causes of headaches include tension, migraines, and sinusitis. So not every headache means you're having a stroke. 4. Numbness or severe weakness. In muscles, numbness or severe muscle weakness can be signs of a stroke. A stroke occurs when the blood supply to a part of the brain is cut off or reduced, causing brain cells to be damaged. When damage occurs in a specific brain area, the associated nerve pathways can be affected, leading to numbness in one side of the body or a specific area. This is often felt in the face, arms, or legs, and usually affects one side of the body. Severe muscle weakness is one of the most common signs of a stroke. When the part of the brain that controls motor functions is affected, it can result in a loss of strength in certain areas, limiting movement, causing difficulty walking, or leading to complete paralysis. 5. Balance and coordination problems. Balance and coordination problems can be significant signs of a stroke. When the parts of the brain that control balance and coordination are affected, the ability to maintain balance and coordination may be compromised. The cerebellum is responsible for the precise control of body movements, balance, and coordination. If damaged, it can lead to loss of balance, dizziness, and coordination problems. A person may struggle with movements they would typically perform easily and may experience unsteadiness while walking. Damage in the cerebellum can also cause weakness or loss of coordination in the leg muscles, affecting the person's gait. Stroke-related damage to the motor control centers in the brain can cause movements to become unsynchronized, making even simple tasks challenging, like grasping or holding objects. 6. Attention and consciousness disorders. A stroke can lead to serious attention and consciousness disorders, if it affects brain areas responsible for cognitive functions, such as attention and consciousness. The cerebral cortex, which governs attention and consciousness processes, can be responsible for these types of disorders. A stroke in areas like the cortex or brainstem can manifest as attention deficits, confusion, and loss of consciousness. When the brainstem is affected, it can cause sudden changes in consciousness, even leading to a coma. These symptoms indicate a severe issue with vital brain functions and require immediate medical attention. 7. Sudden facial drooping or asymmetry. Sudden facial drooping or asymmetry is one of the most common and recognizable signs of a stroke. When a stroke affects the brain areas connected to the facial nerves, it can cause sudden drooping or asymmetry in the face. The facial nerves control facial movements and are directed by signals from the brain's motor centers. If a stroke disrupts the blood flow to the brain areas connected to these nerves, the facial muscles may not function properly. This can result in one side of the face suddenly drooping, becoming asymmetrical or immobile. This asymmetry is often noticeable during smiling or talking, where one side of the face may remain motionless or droop down. A stroke can also cause drooping in one side of the eyelid or mouth. This indicates that the muscles on one side of the face are not being adequately supported, leading to noticeable facial asymmetry. 8. Loss of body control. Loss of body control can be directly related to a stroke, since a stroke results from the interruption or reduction of blood flow to the brain, causing brain cells to be damaged. This can lead to a loss of function in the nerve pathways that control different parts of the body. In the case of a stroke, one or both sides of the body may experience a loss of control. This is referred to as partial or complete paralysis. Depending on the location of brain damage, a person may lose control over an arm, leg, facial muscles, or other body functions. Common causes of stroke include blood clots, brain hemorrhages, and narrowed arteries, atherosclerosis. 9. Sudden severe fatigue. Severe fatigue is often one of the first signs of a stroke. During a stroke, when enough blood does not reach a particular area of the brain, that area may fail to function properly. This can disrupt brain functions, leading to sudden and intense feelings of fatigue. This fatigue often appears alongside weakness or numbness on one side of the body. If a person suddenly experiences severe fatigue, it's crucial to seek medical attention quickly to determine the underlying cause. Stroke is a time-sensitive condition, as the faster you act, the less likely the brain will sustain significant damage. 10. Difficulty chewing and swallowing. Chewing and swallowing difficulties before a stroke can arise when brain damage affects the areas controlling these processes. This can lead to problems like improper chewing and swallowing of food, causing nutritional deficiencies, dehydration, and serious health issues such as aspiration pneumonia. These difficulties, known as dysphagia, can reduce the quality of life for stroke survivors. Treatment and management may involve swallowing therapy, dietary changes, and, if necessary, medical interventions. If you are experiencing any one or more of these symptoms, it is important to contact the nearest emergency room for immediate medical attention. Early intervention can minimize the effects of a stroke and speed up the recovery process. Unfortunately, in most cases, there is no complete recovery after a stroke, but we can minimize the consequences and improve our quality of life by taking care of our general health. For this, it is important to keep regular medical checkups, follow a healthy diet, and get enough physical activity. If you have watched this far, don't forget to like the video and subscribe to our channel. You can also be notified of our new content instantly by activating the notification bell. You can share the video with your loved ones so that they can be informed. Have a good day and see you in another video.